Hello, thank you for taking the time to meet with us today. My name is Brandon Cyrus. I've been with the company since 2007, and I'm currently the software support manager here at Benchmark Systems. I'm here today with Nathan Lane, who is a member of our leadership team, and figured we would sit down, have a little chat about what makes our products and services unique, and what creates such a great team here at Benchmark Systems. So Nathan, I'll turn it over to you to give us a little introduction for yourself.
Thanks, Brandon. So I'm Nathan Lane. I'm currently have the joy of being president of Benchmark Systems. I've been with this organization since 2004 and have basically worked in some capacity with just about every group we have here, from our ProTech team, revenue cycle management implementations, and as you're aware, support.
Great, great. So you've been with Benchmark Systems for a while now, and I feel like that gives you a pretty unique perspective. So what makes working here at Benchmark Systems so special?
So I think one of the things that makes us so special, one of the primary factors, goes back to sort of what's our purpose. Why do we get up in the morning to come in here and do what we do? And I think ultimately that leads into, what we do, what we perceive ourselves doing is allowing the physician to better care for their patients. So whether it's through our products or our services that we offer, whether it's through lowering administrative overhead for the practice, or whether it's providing these platforms so they can more efficiently provide care for these patients. Ultimately, we're making the patient improving their overall health outcomes in what we do.
Great, great. I couldn't agree more. One of my favorite things about working here at Benchmark Systems is being a part of the team. As a leader, what do you think it takes to create the type of environment that we have here at Benchmark Systems?
So that's a good question, and that's not an easy thing to accomplish, I'll say. And I think that's one of the things that I really feel we've done a great job with over the past several decades, to be honest with you. As a company that's been around for 43 years, and our average employee tenure, I believe, is around 12 years right now. One of the things that has struck me since day one is that, this is a company where no one really cares what their title is, if that makes sense. If there's a client problem, if there's an issue that needs to be resolved, everyone kind of jumps in. No one here ever says, that's not my job, or that issue belongs somewhere else. We are 100% geared towards helping the clinic, resolving issues, and really just working with each other. And that's something, again, that struck me from day one. I think that makes a big difference.
Great, absolutely. Now, you may be a little biased, as am I, but what makes Benchmark Systems different from other software and solutions providers?
So what I'm going to say is probably what a lot of our prospects have heard from a lot of other organizations, but I really think that our ideal of partnering with these practices is what makes us different. When we have a client of ours that actually signs a contract, they're partnering with us, we're partnering with them. So we're going to do everything in our power to make them successful, because we know that we're not going to achieve any level of success unless they're successful. And we view this partnership, when we sign, again, when that client signs that contract, we want that client for life. And so I really feel, whether it's through our sales process, whether it's through our implementation processes, and of course, post-implementation support, which you're well aware of, everything that we do is geared towards keeping that customer for the long term. And so I think that makes a significant difference.
Yeah, absolutely. So what does Benchmark Systems have to offer? Give me a kind of a high-level overview of the different products and services that are offered.
Yeah, so from a product standpoint, software product, we have Benchmark Practice Management, or Benchmark PM, which is basically the financial side of patient care. So patient registration, appointment scheduling, insurance eligibility verification, all those things necessary to get claims out the door and get the practice paid from both the insurance and the private perspective. Then we have Benchmark EHR and Benchmark Clinical, where that's the entire clinical side of patient care. So that's documenting the patient's visit using our customized specialty templates, prescribing medications, both controlled and non-controlled, lab results and orders results with laboratories and radiology entities, everything for the clinical side of the practice. Then we have our services arena, which is going to be revenue cycle management. So that's where we do billing for providers that don't want to do billing themselves. They figure, mostly correctly so, that they can outsource that function and get better efficiency. And we do everything there, from data entry if required, all the way up to private responsible billing and everything in between. So your accounts receivable and your denial management, sending out patient statements, taking patient phone calls, which significantly reduces administrative burden to the practice. And then we have our ProTech, or our general IT arm, It does everything from equipment sales, Microsoft license resale, proactive threat monitoring for a clinic where we actively monitor and do patch updates for things like servers and other endpoints like laptops and PCs and servers. And then, of course, networking, infrastructure, and security, which, as you know, is huge now, not only for healthcare clients, but also for other entities that use our general IT service as well, like attorneys' offices, retail, other entities such as that.
Sure, sure. So that's what we offer today. Can you kind of pull back the curtain and let us in behind the scenes? Tell us maybe what's next for Benchmark Systems.
So, in an effort to try and not date this video, what we're always looking at doing is what can we do in the short term, which is typically enhancement requests from our current accounts, because all of those things are important. What do they want to see added to our product development roadmap? But also over the next year, 2 years, 5 years, and beyond, what can we do that's going to help automate some of these procedures in the practice? Again, these could be things that are going to reduce administrative overhead, and they could be things that help make the provider's workflow more efficient. Again, at the end of the day, what we're trying to do, if we can give a minute back of time to a provider in their clinic, that's another minute that they can use to spend caring for their patient. Ultimately, that's going to improve patient outcomes. So whatever the things are that we're doing, that's what we're looking to strive for.
Great. I appreciate that. All right, so let's move down the road a little bit and look at the clients that are thinking of making a change and they're considering Benchmark Systems to be their source for that. As you know, making change for anything can kind of be overwhelming, but especially for our busy healthcare providers. How does the team here support those transitioning clients?
So from a support perspective, when we have a transitioning account, so if we're looking at a new provider that's coming on board, so one of the things we do from an implementation perspective is we assign them a dedicated account manager that basically is going to hold their hand and walk them through this entire implementation journey, because there's so many steps involved, whether that's from working with their old vendor to get data, assigning training schedules for all the staff. It's going to be front office, back office, physicians, nurses, medical assistants, helping schedule all of that so everyone can get the training they need, and then also going through whatever customizations may be needed. Going from one system to the other, it's not like going from an apple to an apple. You're probably going from an apple to an orange, and so we need to make that transition as seamless as possible. So there's a lot of work that goes into that, and one of the things I think that we do wonderfully is with that single account manager setup, we guide that practice through those steps and kind of walk them along that journey.
Great. If you could give one thing that really tells a potential client out there why they should switch to Benchmark Systems, what would that be?
So I think I'd go back to that ideal of the partnering practices that we spoke about earlier. I think that as a single point of focus for us and our clients, that encompasses so many things. Because again, what we're looking to do is make that clinic successful, whether that's a single doctor, single site clinic, or a multi-site 20 physician group. We are partnering with that organization. And so what we want to do is partner with that organization and make them successful and keep them as Benchmark Systems partners or customers for the longevity of their practice.
Great. So how do we ensure that the transition is seamless for patients as well?
So it's actually a good question. And I think that that's one that the clinic and sometimes the clinic and oftentimes the vendors don't think enough about. Usually a lot of the focus is how do we get the clinic up and running as quickly as possible? And they don't necessarily always think about what's going to be the impact of the patient. I think you have seen previously, we've all seen it, where we go into our primary care provider, we go to our appointment or specialist, whatever it may be. There's that sign on the front desk that says, please excuse the delay, we're transitioning to a new system. So I think the two primary factors when it comes to patient are that, number one, data. So one of the things that I think we don't think enough about, or at least spend enough time validating, is that data coming from system 1 into system 2. One of the things that I think that we do a really good job of is maintaining that relationship, at least somewhat, with that third-party vendor to get the data, review the data, look at it for accuracy before we get it into our system. And then we hold sessions with the clinic to actually review it and make sure it still looks good. One of the biggest holdups with a patient at that front desk is sitting there going through each line item piece of data to validate it. So if we can do as much of that on the back end before the client goes live with the system, the better patient experience. I think the other part of that is the template customizations and the EHR, and the customizations of the workflows. If we can get a provider to the point where they feel very comfortable with the system that they're now using from a documentation perspective, they're going to be able to more naturally go through that as they're talking with the patient. Oftentimes, I think you have a provider that's struggling with the new system because they haven't been adequately trained and they haven't had a say in these templates that get set up for them. And so they're sitting there trying to document, do all the things that they need to do from a government reporting perspective in the system. And here's the patient that's sitting in the room. And so our effort, our primary goal is to make that provider as comfortable as possible when they're using that platform so they can spend less time trying to figure out the system and then spend more time caring for the patient.
Thank you, Nathan, for meeting with me and giving us some insight into everything that goes on here at Benchmark Systems with the products and services and the great team here. If anyone would like some more information for Benchmark Systems, you can visit our website. That is www.benchmarksystems.com. Thank you.